Welcome back. This is Michelle Hughes. I'm so happy to be here today. Actually, getting ready to move back to San Francisco from Los Angeles. So, this is one of my last studio podcasts. However, you're not going to forget about me because I'm going to continue doing the Zoom remote by my home in San Francisco. So stay tuned. We have lots more good stuff coming in the ensuing weeks. Today, my guest is Patti Dixon. And we're going to be talking about a subject that I know is very interesting to a lot of people. But you think it might be just women, but it actually is both women and men. And I'll tell you why in a moment. The subject is platelet-rich plasma, and that is PRP. That's the acronym for platelet-rich plasma. And we're going to talk to Patti, who is one of the forerunners in this industry. She's been doing platelet-rich plasma for about 10 years now, since 2009, but she's had 30 years in the pharmaceutical, actually in pharmacies. Correct, Patti?
Right.
Okay, well, welcome to Ageless and Timeless. And Patti is a graduate of University of Houston. Her office is very close to Houston in a town called Stafford, if anyone is familiar with that area. And Patti works with George Brexit, who's, is that how he says his last name, Patti? Brexit?
Bretz.
Uh-oh, I just lost
Brett.
the audio. Hold on.
Brett.
Hold on one second, Patti. We lost your audio. Okay,
Okay.
try again.
Bretz is his last name. Bretz. Bretz.
Can you raise it a little bit? I'm losing her. Okay, Patti, hold on one sec. We're trying to little technical glitch here.
All right.
That's better. Now I can hear you.
Well, I'll move closer.
Okay, there we go. So, and what? How do you say George's last name?
Bretz. Bretz.
Oh,
Bretz.
Brett's. Okay, sorry about that.
That's all right.
I'm thinking of England.
You're right.
Right? So you and George have been business partners for a very long time, and you've evolved this business called Dr. PRP, which I think is a very interesting name. Would you tell us, first of all, how has PRP changed since 2009 until today? And that's one part of the question. The first part of the question, maybe before to answer first, is what is PRP? What is platelet-rich plasma? So let's start with that, and then segue to how has the procedure changed in the 10 years that you have been involved?
Okay. It started early in the 1990s, maybe. It was first discovered by an dentist, and they used it in bone grafts and implant surgeries and things like that. And they learned that it would stimulate the bone growth much more quickly, and the bone would grow back stronger. They were able to put the implants in a little bit quicker, and they had less failure with it. And it moved into sinus lifts and things like that. From there, it went into general surgery in the OR, and they used it in cardiothoracic surgeries. Before they would close the patient up, they would mix this platelet-rich plasma with calcium chloride and thrombin, and they would use an apparatus and they would spray it into that open wound right before they suture. And then those patients got out of ICU much more quickly. They got off their meds quickly. They just did better in general overall. They had fewer bringbacks, fewer infections. And from there, they went into open knee surgeries and open hips and spines and things like that. So at that time, the hospital paid for it. And then the geek scientist would sort of put their little science caps on and think, well, if it would help with healing in the OR, what would it do if we just injected it into tissue? So they began to inject it into joints for musculoskeletal disorders or sports injuries or arthritis or any kind of an overuse syndrome. And they learned that the platelets would then go into that area and they would stimulate healing in an area that may not have that much blood flow where platelets could get into the area to heal. So, backtracking for those who aren't aware of what PRP or platelet rich plasma is, it is a process where we take a little bit of blood and we separate the components out, the red blood cells from the plasma and the platelets. The platelets are the cells in your body that do the actual healing. When you cut yourself, platelets rush to that area and they start to knit that cut together, and then they release growth factors. There's over 20 growth factors, more than that probably. We're learning every day more and more about all of the different components and growth factors that are in the platelet that releases that cascade of healing. But we learned back in probably 2006, 7, 8 that if we would take these and harness them and inject them into an area of damage, that they would start to heal, and in many instances stave off surgery and actually start to heal that tissue, such as a torn or a frayed ligament or a tendon or meniscal damage, anything that you might have trouble with just out of aging or out of an accident or overuse. Those platelets, when placed in that area strategically, can go in and start to heal that tissue. When we inject them into the face, in that dermal layer, they sort of see those wrinkles and that flattening, thinner tissue as damage. And so the platelet starts to get to work immediately and starts to repair and sort of rejuvenate and thicken that dermal tissue. It does the same thing with hair. A hair follicle is in that dermal papillary layer, and it will stimulate that hair follicle to start growing. So we use it in lots and lots of aesthetic applications.
That is so fascinating. So the platelet is stimulating a circulatory response as well as a growth factor healing response. Is that how you would?
It stimulates. It does a lot of different things in those growth factors, and also other cell signalers that are in that plasma that we inject are lots of signaling uh, factors, and cells communicate and they talk to one another. And when there's damage, if there's a lack of these platelets, there's a lack of this communication highway. So putting those platelets in that area stimulates the communication, and it tells the cell what to do, when to sort of create tissue, when to stop the inflammation, when to um, bring in a certain amount of healing of bone or skin or whatever that tissue is that is damaged. Those signaling factors are doing the work, stimulating your body to do what it would normally do.
So, Patti, why a platelet? I mean, there are other parts of the blood that are also have circulatory and healing properties. So, why platelets?
The platelets carry the growth factors. When you look at a platelet under a microscope, it's a little disc or a disc-like shape. When it is called to the scene of injury, it is stimulated to open up. And then when it opens up, it looks more like a knotted up little knot with all of these little protrusions in it. And that's sort of what forms the scab or the healing part. As that starts to degranulate or degranulize, those growth factors are released. Red blood cells have a different function. They carry oxygen and nutrients and things like that. White blood cells are the inflammatory response cells. So each different cell has a different function. The platelet is the one that carries that knitting together factor or that healing factor. All of them work together in a healthy scenario when there's nothing wrong to do their own job. The platelet's main function is to heal.
Is to heal. So, what has to happen before the platelets are centrifuged? What do you do to prep the patient to determine the adequacy of the platelets? That everything else about the patient is healthy enough to be able to do this procedure.
They can usually go in and have a series of blood work done. It's not necessary. Um, Most people in general are fit and able to have PRP therapy. If they are on anticoagulative therapy or heart medications, which will thin the blood, a lot of those will work by inhibiting the platelets' ability to stick together
Right.
and release those growth factors.
Right.
So if they're on an anticoagulative therapy or some heart medications, they may need to get off of that if their physician will allow it for a week or so, and then the blood can be drawn. But normally there's not anything special that they need to do if they're in overall, general good health. They can go in and have their blood drawn. It doesn't take very much blood. Our little system operates on 20 cc's of blood, which is not very much. It is it goes into the centrifuge. It's centrifuged for about 4 minutes. It will then isolate those platelets in an area where we can capture them. We can lock them away from the red blood cells, and then we can manipulate that top product, and we can do a lot of things with it.
So, what kind of downtime is there for? Let's just focus for a moment on the aesthetic, on the face.
Okay.
I assume it's the face and the décolleté that can be done for
Neck, back of the hands, yes.
back back of the hand. Okay, so let's just focus on aesthetics for the
Okay.
moment because there are so many applications that you've already touched on. However, I think for today's podcast, we're going to stay with beauty and aesthetics. So,
Okay.
if that's okay with you. So,
Most fun.
okay, I know it's a big subject. So, 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 what kind of downtime? If a patient comes in, has a procedure, can they go right back to work, or is there swelling or bruising, or what normally do you
Yeah,
see?
many times they can go right back to work. It depends on what they're having done. There are lots and lots of ways that we can get the platelets into the skin to do what we want them to do. We can directly inject them
Mm-hmm.
manually with a needle and a syringe and just inject the platelets all over the face.
Mm.
We can use a system called a micropigmentation device, which is what they use for tattooing. And it has a multi-needle cartridge to it. And you can drop the platelets onto the face, and then these needles go in very quickly. And the platelets get driven into that layer through those needles as they puncture the skin. They make little teeny tiny microchannels. The platelets are driven in that way. There is an automatic injection unit that you can use, which has either 5 or 9 needles. You can dial in the amount that you want it to deliver into the skin. You can dial in the depth that you want it to go, and you can dial it has a suction mechanism that sucks the skin up to the cartridge, and you can dial that in. So
Sounds
you
like
can really go ahead.
no. I was going to say it sounds like that's a more cutting edge.
Let me tell you that technology is the newest technology that we have. We worked with it for about a year before we decided that it was a nice way to get the platelets in the area to do their thing. What we didn't bank on and was a nice surprise was that the results were so much better. There's fewer bruising.
Mm.
The patient many times can return to work the next day, whatever little teeny tiny marks that the needles make are normally covered up by makeup. There's not a lot of swelling. Bruising is rare. It does happen. For a year, I was bragging, oh, I've never bruised anybody with this. I've never bruised anybody with this. And then lo and behold, I was doing a demonstration. And I bruised somebody right there, right there. Come to find out, she was on a lot of Retin-A, and her skin dynamics had changed. But you can bruise with it a little bit, but it's not like the old days.
Well, so what do you combine with the platelets now in the more advanced applications that will be even a better result than pure platelets?
You're going to start hearing a lot about cord blood stem cells and what they can do with the facial rejuvenation. Now, the FDA does not allow us to mix the PRP and the stem cells. So what they'll do is they'll use them in tandem. So they'll inject a little bit with the platelets, and then they'll turn right around and they'll inject with the stem cells, and then they'll follow up and do another.
And why is it that the FDA does not allow you to combine the platelets with the stem cells?
Because Big Pharma does not want us to use our own bodies to heal ourselves. And so they claim that when we do that, we're making a drug.
Oh, I see.
So it's just it's not true. You're not creating a drug, but in order to stay compliant, which we do, we work with it and do exactly as we're told and not as we're not supposed to do, and work our way as best we can with it.
So where do the stem cells come from?
Normally, cord blood. If you wanted to have your own tissue processed, you could do that. That's rather expensive.
Yeah.
The best way, I think, to do it, and this is my personal opinion, is through cord blood stem cells, because it's a readily sourced product. The mothers are screened, and the product is screened, and there's a wonderful company that we work with out of California that has their own proprietary technology, and their protocols are extremely stringent. Many times they don't even pass their own test, and so they have to throw out
is that the company in San Diego, Stem Medica?
No.
Okay.
No.
Well, that's okay. I know that there are some certain things that are proprietary, so I don't want to probe on who the sources are, except that we all know that stem cells have some efficacy issues, and it really does depend on where they're being harvested. And it seems like you're saying these are pluripotent or autologous stem cells, adult stem cells?
They're not autologous. Autologous means that it comes from the patient, you.
Okay.
So adipose, if you had your adipose tissue a little bit liposuction done, maybe on your tummy or hips or thighs, and they took that right away and they processed it and they got the stem cells out, they could do that for facial aesthetics. It's from cord blood, so that's from donated umbilical cords of babies and mothers who were enrolled into a special program, and they were followed throughout their pregnancy and then tested, and then the product was tested.
And I assume that you have to do some very diligent testing to be sure that these are pure.
It is highly regulated.
Yeah,
it is highly regulated.
Highly regulated, right? And what about dermal fillers? How does that work with a combination of the PRP?
That works very, very well. They'll normally go in and do the facial fillers first, and then they will follow up with PRP in and around that area. The PRP sort of likes to use that as a scaffold, and it will sort of set up housekeeping wherever that filler is, and it'll start working with that filler to enhance the filling of that space with like tissue.
If we go on your website, can we see some before and after pictures?
I don't think so. there in our blog section you may be able to find some, but we don't always get permission to put things like that on
On, yeah,
site.
on the site. Okay. So, but what is your website, just so we can let the viewers know?
It's drprpusa.com.
Okay. So DRPRP, Dr. PRP, USA.com, just for
Right.
anyone that wants to look further what the protocol includes. So, okay, Patti, I'm going to ask you a personal question. So, what have you done? Everybody's going to want to know because you look so good. What have
uh,
you done and how many times, and what exactly have been your conclusions? Let's talk about you for a moment.
okay, way back when we very first began to explore the thought of injecting PRP, I was our first guinea pig, and that was back in 2000 and probably 10.
Mm.
And we had an older system. We took 120 cc's of blood and we injected all over my face, in my neck. We did the backs of my hands. And I committed at that time to do nothing else for a year because we wanted some firsthand knowledge as to whether or not this worked. At the time, there were only a few papers that had been written on it. And at the time, that was my job to go out and sell these services and these therapies to providers in our area. So we needed to see, does this work before we open this market? And at about 5 weeks, I went back to the nurse that injected me. I said, I don't think it did anything. I don't think it did anything. I'm so disappointed. I'm so disappointed. And she said, oh, I don't know. I don't know. She said, let's take your pictures and see. I said, okay. But the patient sees their face every day, and the changes take place very, very slowly every day.
Mm.
And so we took my picture and we printed it out, and we took pictures with makeup and without makeup so that we could see a fair comparison. A lot of places will take the before picture without makeup, and then they'll take the after picture with makeup, and
Right.
that's not a fair assessment.
Right.
So we took the pictures with makeup, and then I went in and I washed my face, and we took the pictures without makeup, and
Mm.
we held them side by side. And I just thought, wow, it looked like to me, it took me back about 18 months in aging in that 5 week
Mm.
time. So we kind of decided at that point, yes, this is real, because the maximum benefit that a patient can visually see is right at about 12 weeks. And
Mm.
so we did additional follow-up photos at 12 weeks, and there was still yet additional improvement. After that 12th week, there are still healing and changes that are taking place, but it's not really discernible to the human eye. They have to do histological studies and look at it under a microscope to see. And there are some studies that say and show that even as much as 12 months out, that tissue is still being rejuvenated. And
Mm.
at that point, the aging process sort of starts over again, and it's time to redo it.
Mm.
The ideal scenario is to have 3 treatments,
Mm-hmm.
30 days apart, and then evaluate 3 months after that last treatment.
Mm-hmm.
That seems to be the same with hair restoration, face, cellulite, um, even bones and joints. If you're going to have to do multiple treatments, that seems to be about the standard protocol, even though there are gurus in the field who have their own protocols and they have their own rehab protocols, and they might say something differently. And I certainly respect and would advocate whatever they tell me because their pay grade is a little bit higher than mine.
So you,
So
oh,
that just seems to be a standard um, protocol
Okay.
that the patients really see a lot of benefit
So
from.
90 day, it's a 90-day commitment. Every 30 days you do a treatment for 3 months, basically, for 3 times. And
Yes,
then over the next 12 months is when you will see gradual and subtle but definitely
mhm,
improvement. Is
a
that
lot of it. Yeah, yeah.
That's a fair
So
assessment. So
that
what
is.
what about microneedling and the vampire facial and all these kind of I don't know. I thought they were fads, but everybody's talking about them as if they're here to stay, like Botox. So, tell us more about how that microneedling or the so-called vampire facial fits with what you're doing with PRP.
Okay, the vampire facial we're not allowed to discuss because that is a trademarked
Ah, okay,
uh, procedure.
okay.
So we need to be very clear that we do not use that term.
Oh, okay. Sorry about that. But what can you say? What is a vampire facial without saying?
I cannot because
Okay.
I'm not associated with the physician that holds that
Oh,
trade.
okay. How's the patent? Okay,
But
no worries.
a platelet-rich plasma facial or platelet-rich plasma facial rejuvenation is normally um, platelets are injected into the face in lots of different ways. They might do little teeny tiny meso-like injections or like little teeny tiny injections all over the skin.
Mm-hmm.
They might just inject it in strategic areas like under the eyes, in the
Mm-hmm.
nasolabial folds, and the marionette lines, and then they might microneedle it all over the face.
Mm-hmm.
That's very, very popular. That downtime is a little bit longer because those needles going in and out, in and out, in and out of the face create quite a bit of trauma.
Mm-hmm.
And that's where that healing cascade starts. In about between 4 and 10 days, you'll peel a little bit as if you had a facial peel, but not a lot. And then the most beautiful skin emerges about that 10th day, and your skin just looks amazing.
Mm-hmm.
You could do another PRP therapy then, but I say, why don't you just enjoy that beautiful skin for the next 20 days and then you hit it again and do it. And then 30 days later, hit it again and do it. But we know that every PRP treatment synergizes itself upon the PRP treatment prior to, because those platelets are still working. So you do this wonderful facial treatment, the platelets are working and they're rejuvenating, and you give your face a little bit of a rest and you enjoy that beautiful skin. And then you hit it again. And now the integrity of the skin's a little bit stronger. It's a little bit more, um, the dermal layer is a little thicker. It just gets a little bit better and a little bit better and a little bit better. I have yet to see somebody that I look at and say, they've had too many PRP treatments.
Say, say,
I
say,
have seen people and I thought, they've had too much Botox, or they've had
uh,
too many fillers, or
uh,
but I have not once ever looked at a person and said, ooh, they need to hold back on that PRP. It
right,
just doesn't
right,
happen. It's the nature of the therapy. It's hard to overdo PRP.
right. Wow. So the the- this is the this is a maybe an unfair question. So if someone comes in and you see really deep wrinkles and scarring and pigmentation, really, really extreme condition,
Mhm.
do you ever turn someone down because you know that their expectations may exceed what reality can produce, even with the PRP?
I might ask them to give it some serious thought about what they really, really um, are going to expect out
Mm.
of one treatment. And if I think that I'm not going to be able to deliver that, I'll say, I can't do
So
that.
you do interview the patients beforehand,
Sure.
because I'm
There's,
thinking about so many people who are extremely unrealistic about how a protocol can affect the result, and then they are just walking down the path of disappointment, and
Hmm.
then of course holding you as the facilitator,
Hmm.
in responsible for that. So there's a I mean, you do have a psychology as well as a procedure. You know what I'm
And I
saying?
think every provider does. Every
Every.
provider needs to
Mm,
make that distinction,
mm-hmm.
um, and find out what the motivation is for doing that. If you're just feeling well and you want to look as good as you feel, I'll always tell my patient, I can't take you back to better than you were a year or two ago,
Mm,
but I can take you back to very similar to where you were a year or two ago. And
mm,
with each therapy treatment, it seems to do that. And I also will tell them that is my own personal opinion. That is not a scientific opinion. That is just what I think by looking at photos of myself and people that have had it done, how many they've had done. I don't know how many I've had done since 2009. Not as many as I would like to, because it's
mm.
like the shoemaker. They have, the worst shoes of anybody.
But
But
when you do today, because so much has changed, as you've said, the application has changed to be far
uh-huh,
more effective.
uh-huh.
The contents of the plasma have changed in the sense that you can add, or at least combine, let's say, other
In
element.
tandem with
Right.
other cellular modalities. Uh-huh.
Modal. That's a great way to say it. And
Yeah.
so okay, given where we are today, and this is what my very first question was to you, other than to define PRP, is what has changed over the years? And you've touched on that. But now today, if let's say right now we were going to do a procedure in your office on you, or somebody
Mhm.
is going to, what would you be requesting of the provider to get the maximum results for you, as you have had more experience than most with this? So where would you?
I would ask for a PRP facial injection with the automatic injector.
Okay, and would you combine it with stem cells, like you said earlier, or
If
with?
I could afford it, I would. I did that in April the 1st.
Uh huh.
We did a cord blood stem cell
Okay.
injection. I did one and George did one because we wanted to see and we wanted to measure and we wanted to look at the outcomes and see what the difference was. Downtime is nothing, nothing. I mean, 24 hours later, I have a picture. You can't even tell I had anything done.
Anything done? Wow, that's
Yeah,
amazing.
yeah, and it was just amazing. And I was just visiting George in the hospital, and a woman that he did from his church came in and visited. She looked amazing, and
Mm-hmm.
I know he did a stem cell on her with the automatic injector, and I know he did a PRP
And
on
what
her with
where do you see the greatest results? Is wrinkles or pigmentation or volume,
all of it,
or
all of it,
where is the
all
greatest?
of it. I would all of it. Not necessarily so much volume because platelet-rich plasma and even stem cells can't do a lot for volume loss. That's a fat loss issue. That's a
Yeah,
filler's job,
yeah,
or fat grafting.
right.
But what it does is it I want to say it shrinks the skin, but it doesn't shrink the skin. It just boosts that integrity of the skin so that when the skin lays over the skeletal structure, it's not sinking into the sallows as much as it's kind of holding on to the skeletal structure
Mm-hmm.
and the muscular structure. So mostly when we lose volume, it's a lot of loss. It's muscle loss, it's fat loss, it's bone loss, it's all of those tissues.
Mm-hmm.
So when the skin has a little more integrity to it, it sort of holds on to whatever that structure is with uh, um, a little more integrity. So it's like using a cotton sheet and a quilt. If you put your hand on a table and you lay a cotton sheet over it, you'll see your hand underneath that sheet. But if you put your hand on a table and you lay a quilt over it, you'll see sort of less of that hand. You
Mm-hmm.
might see a little bit of it, but it's just covered a little bit better by that thicker material.
Mm-hmm.
And that's what PRP does. It just thickens that layer of the skin that's responsible for your collagen and your elastin. And that's um, just right underneath the epidermis. The epidermis is the part that you see.
Mm-hmm.
The dermal layer is underneath that.
Mm-hmm.
And that's where all of the strength and the structure and the integrity of your
And
skin
most
is.
cosmetics, we all know, never make it to be below the epidermis, right? So
They
they're you kind of
Yeah,
it's like
because
really a
that's the
surface.
epidermis job is
Uh,
to keep things out of there and to protect that.
mm-hmm.
So getting your cosmeceuticals in there is a difficult job unless you have an apparatus like a microneedler or
Mm-hmm.
something that will pierce that skin a little bit and you can drive those cosmeceuticals into that layer. They're not going to get in.
Mm-hmm. I know. I know. Um, so, Patty, when someone comes to you and they want to do the whole body, and we're trying to stay with aesthetics today, but what if somebody says, I don't like the way my arms look. I'm, just having laxity, and they're looking for the PRP to do, effectiveness in other parts of their bodies. Do you ever allow those injections to other than the hands? Do you ever allow them in the
Yeah,
legs
you
or
can.
the
And again, it's not going to do what a plastic surgeon can do.
uh
What it is going to do is just give that skin a little more integrity. It
right,
might sag a little less, but if like this area right here, if that's saggy,
yeah,
you can make it look a little better from the integrity of the skin structure, but you can't. That's a tissue problem. That's not a
right.
skin
Right.
problem.
It's laxity, skin laxity, which, this is not taking away skin laxity. This is actually helping the skin to look healthier,
Right.
which actually brings up my other burning question for you. So we all know the skin is the largest organ in the body and that it does reflect our overall health. And the PRP is, going to be one modality that can affect
Mhm.
results, positive results. However, what if someone has a lousy diet and they don't exercise and their sleep habits are terrible and they drink a lot, so in other words, what if the rest of their lifestyle is going to diminish the effectiveness? How far can PRP take us if the rest of the program is not intact? And then the second part of that question is, how do you try to facilitate that change so that you do get the maximum efficacy from the injections?
That is a great question because it is a whole body issue.
Mm-hmm.
Um, Even if they come to me and they have a poor diet and they're maybe a smoker and they're out in the sun all the time, I can tell them, yes, a PRP treatment will help your skin look a little bit better, but the results won't last.
Mm-hmm.
It's like taking a flower and planting it out into your flower bed,
Right.
and it's going to look good
Well,
for a
you've
couple of
given it a
days.
little fertilizer. However, you may not be giving it
If
the
you're not
water that it
watering it,
needs.
if it doesn't get any sunshine, if
Yeah.
it, it's not going to live. It's not going
Right.
to last. So yeah, I can make it look a little bit better, but it's not going to last. So that's not typically our patient. That's not typically the patient um, that most providers are going to see. Their patient is normally somebody who feels good, looks good,
Mm.
still in the workforce, um, younger also. Women and men are
Mm-hmm.
starting to think more in terms of longevity
Mm-hmm.
and preventive maintenance.
Mm-hmm.
Um, And those are typically the patients. They're more aware of diet and exercise and
Mm-hmm.
environmental stress on their body. And that tends to be the normal PRP day to day patient. Occasionally, you'll get somebody who's a heavy smoker and a different lifestyle
Mm-hmm.
than um, more self care.
Mm-hmm.
And you can help them a little bit, but they're going to have to address that inside of their body. They're going to have to address nutrition, exercise, sun exposure.
Mm-hmm.
It's a whole body issue.
When they do the 90-day program, do you have to stay out of the sun completely, or wear very, very intense
I
sunblock?
would
Or
suggest it. I would suggest it if you're going to do a PRP treatment and you're going to spend the money to do that and you're going to microneedle on top of that,
uh-huh.
that new baby skin is new. It's
Mm,
baby tissue.
mm,
You wouldn't take a brand new baby and put it out in the sun. Why would
mm-hmm.
you do that to your skin?
Right.
So, yes, I would say stay out of the sun. If you
So
absolutely have to be out in the sun, then protect yourself. You
right,
just spent a bunch of money to get this new skin.
right.
Why are you going to go put it in the oven?
So it seems like we're coming into the months where people should be thinking about if they want to do the treatment, go do it during the more the winter
Yeah,
months.
yeah.
Particularly those of
Plastic,
us, California,
plastic surgeons
Florida,
and
Houston, all those are areas where we have intense sun.
all the time.
Yeah,
Yeah.
yeah.
Plastic surgeons call that the pretty time from
Yeah, no.
October through March.
Right. I
That's when
always say my birthday comes at the right time, November 1.
there
I
you
can
go.
now think about all those treatments
There you
that
go.
I
That's right.
couldn't do in the summertime, right?
That's right. That's right. Now
So,
is the time. And then when
so,
summertime does come, get you some good sunscreen, wear a hat, protect your eyes,
right, right.
protect your hands, your neck, protect it. That's the only skin you're going to get the rest of your life.
That's right. And of course, we are finding all these ways to rejuvenate it, but that doesn't mean you're going to have a meal ticket for a new skin. It's just it may be a renewed skin,
That's
right?
right. That's
Right.
right.
So, Patty, what are the scientific studies that, many people don't ever want to do any treatments until they know that there's good science behind the protocol. So, what would you say about the depth of the scientific studies and the demonstration with the FDA? And in other words, give us an idea of how much is behind and in the depth of PRP.
Now there are tons and tons of papers and studies, and you can go on Medline and uh, any medical website and just search the term PRP facial rejuvenation, PRP tissue stimulation, and you can even go on the um, NIH.gov site and look at the studies that have been done. And
Mm-hmm.
there's now plenty of data that supports the efficacy and the rationale for employing this kind of a therapy for skin rejuvenation and tissue rejuvenation in general.
Are there licenses or certifications, or do you need to be a doctor? What are the qualifications required to inject PRP?
Every state is different. So if you are a provider, I would suggest that you check with your licensure boards, your state boards. In most states, an RN, a nurse practitioner can do it. And in some states, there are other credentialed medical professionals that can do it underneath the supervision of a physician.
Mm.
Certainly any physician can do it just about in any state, but my recommendation would be to check with your state board because the laws are different everywhere all over the union.
Everywhere. Okay. But before you can sell to a potential customer, do you have to qualify them before you can write an order for your equipment to be used by them?
Yes. We
Okay.
have to have their license,
Okay.
their medical
That
license.
they are a
It's
provider,
a prescription. Yeah,
qualified.
the processing system is a prescription item. So
Okay. Okay. Good. So, Patty, before we run out of time today, because time goes by so fast when you're having fun, right?
I know,
And
right?
and by the way, we've learned a lot from you, and this is really helpful because, like I said at the intro, there's so many options that we have for our beauty treatments, both invasive and non-invasive. This is basically a non-invasive treatment
Mhm.
and no downtime. So it really has a popularity today with people that really, busy people who want just to look their very best. And that's what Ageless and Timeless is all about, of course,
Right, right.
is realizing your full potential, looking and feeling your very best,
Mhm.
and certainly your outer beauty is a part of that. Inner beauty, of course, is all another aspect. But sometimes when we affect our outer beauty, our self-image improves, and
That's right.
that changes some of our perceptions. So
Right.
well, so my question is the aftercare.
Mhm.
I don't want to run out of time, and I want us to talk a little bit before we go about how people can access your care, your particular care. But just tell us for a minute or so, what do you recommend people do for aftercare? I know you have a cosmeceutical line, and I understand that one of our prior podcast guests has been on, was on our show. It was one of your vendors. So, but tell us a little bit about your cosmeceuticals. Just touch on it. We don't need to spend much time, but if people want to go ask you about aftercare, they know they can do so. But so, what do you recommend?
I usually recommend just after they have a uh, PRP treatment, we have a facial mask that we will put on them.
Hmm.
It's a
A
um,
healing mask.
it's a healing mask.
Hmm.
We have a company called Rebel.
That's who was
And,
on our podcast, Rebecca Bell.
okay.
Right. Yes.
She's got some fabulous, fabulous products that we usually use and recommend, and
Yeah.
we sell here
Right.
in our facility for a lot of reasons. But the main reason is they are pure,
Yeah.
they are of the best quality, they are affordable,
Right.
and they just work.
Right.
I've
So
not tried any of those products, and I've even tried some products that I didn't realize it at the time, but weren't really best for my skin.
right.
But they're just really, I have yet to come up against a product that I thought, oh, that didn't work so well, or I didn't really like that. But her products are really um, stellar, just really stellar.
Well,
So,
she's a PhD, and she's a scientist who really wants to make a difference in how people look. So you have to look at the substance and the depth. They just gave me
yeah,
the high sign that we're just about out of time. So I'm going to cut the cosmeceutical side short, if you don't mind. But tell
sure.
us how people can come to get treatments from you, or to some of your providers, if you want to give them a little. Plug a referral to people who are geographically not near Houston and want to access. Is there anything that you can tell us in 2 minutes?
Yeah, real quickly. We are located in Stafford, Texas at 3727 Greenbrier, 77478. There is a facility in Merrimack, New York.
Mamaroneck,
Merrimack, thank
New
you.
New York.
Highbrow Beauty and Cosmetics. Your number is 914-450-5543. There's a Dr. Leonard Rollman who's in Orange City, Florida. His number is 396-775-6879. There is I'm trying to think of off the top of my head.
You know what we'll do? I have a great idea. What we'll do is I will get from you a list of the providers in the different geographic areas, and I will post it on my website, which is
Wonderful.
agelessandtimeless.com. In the
Wonderful.
meantime, if people come to you, I know you were telling me earlier that you wanted to offer a very special incentive if someone travels to Houston to have a treatment or several treatments. So could you describe that?
Sure. If they are interested in either hair restoration or the new technology that we have with the auto injector on the face, that treatment is typically $1,200. And if they want to come in and have that treatment done, we'll do one for $1,000. If they want 3 treatments in a row, we'll do that for $3,000 instead of the $3,600.
So basically, so if they do 3 treatments, they're going to have $600 discount.
Yes.
Right? So it'll be $3,000 or a 20% discount.
Yes.
That's fabulous. Okay, and then if they come to Houston, can they do it in a day or do they have to stay overnight?
No, they can do it in one day.
Okay, they come in the morning, they do the treatment, they get on an airplane and go home that day if they want, so they don't have to deal with accommodations. Okay,
Yes.
perfect.
And
Okay.
nobody will probably know that they had anything done.
Right, exactly. Okay, well, we're all out of time, Patti, but would you once more say your contact information so people who are listening and viewing can get in touch with you personally, and you can treat them with kid gloves because they're all mostly people who have never done this before and they need a lot of hand holding.
All right. Dr. PRP USA. The name of the clinic is Cellulum. We're at 3727 Greenbrier, Stafford, Texas.
Okay.
77477. Our phone number, my direct number is 832-434-0832, and I'll take good care of you.
Will you say that one more time, Patti, your phone number?
832-434-0832.
0832. Okay, we got it. Okay, Patti. Well, I hope George feels better. I'm so sorry he couldn't join us today, but I am so thankful that you were available and we could get this aired today because it's really an important part of our podcast. So thank you very much for joining us, and we wish you the very best.
Thank you so much for having us. It's been a blast.
And by the way, Patti, when people call, they'll just use the code Ageless, or they'll just say my name, Michelle Hughes, and that way you'll know that they're coming through us and that people heard you today and saw you today. Okay. All right. Yeah. You have a great day. You're looking great, Patti.
Thanks so much.
Okay. Bye-bye. Bye-bye. Well, I'm so happy that we had this opportunity to air Patti's discussion and explanation of a modality that many of us have questions about. I know I have, and I've heard people who have done this treatment before. I never have, but I think it's something that might be interesting to try. And so if you have any questions or comments, please put them on my website or contact Patti directly. Of course, there's a lot of information that she provided today, but there's probably many more questions that you would probably want to ask. I know I have a few that I'm going to be calling her about. So thank you again for joining us today. This is Michelle Hughes at Ageless and Timeless. You have a beautiful day. 'Cause you're